I remember my first year point like it was yesterday. I've been a nurse for a year now. I don't know if I want to be a nurse practitioner. They look so stressed out. I didn't know if I want a patient caseload like that. But there's so many options in nursing. I don't know what I want to do. I only came to nursing because I wanted to be a nurse practitioner. But now that's not what I want to do. Welcome to my podcast. It took me a while to find the greatest secret in nursing. All I knew was nurse practitioner, or what we call NPs. Now that I'm seeing case managers, utilization managers, unit educators, ECMO specialists, infection control nurses, nurse practitioners not looking so hot. But I want advanced practice. Here's the greatest secret: nurse practitioners are not the only advanced practice nurses. The greatest secret in nursing is what we call APRN, or Advanced Practice RN. So, what is an APRN? APRN is a mid level. They have an advanced scope just like a PA. M- MPs fall under Advanced Practice RNs. Advanced Practice RNs are nurse practitioners, clinical nurse specialists, CRNAs, which stands for Certified Registered Nurse Anesthetists, and also nursing midwives. So, nurse practitioners are one form of an APRN. You can be a psych NP, acute care NP, primary care, family, or what we call emergency nurse practitioner, which is nothing more than a family nurse practitioner with a year of emergency fellowship. The thing about nurse practitioners is it's broken down by patient population. You can either do peds or do adults. Some are even dual certified. For example, I have a friend of mine who he's going to school now to be a psychiatric nurse practitioner and a family nurse practitioner. When he finishes, he'll take both boards and he'll be certified to do both. The scope difference, though, is I think what's amazing. So the scope difference, for example, an acute care nurse practitioner can intubate, central lines, do chest tubes, yada yada yada, where a primary care nurse practitioner doesn't. Another APRN is what's called a clinical nurse specialist. There are scope differences in different states. Just like a nurse practitioner, a clinical nurse specialist can do things like diagnose, treat, and they also have prescribing rights in certain states. But what a clinical nurse specialist is they have different sub roles like educator, they're expert clinicians in their patient populations, they're researchers, and they're consultants. I have a friend of mine who he's a flight clinical nurse specialist slash NP. He's dual. And then I have another friend that's a clinical nurse specialist. She's a critical care transport clinical nurse specialist. Her main job is to revise protocols with the medical director. I've seen jobs for clinical nurse specialists in the ICU, and also I've seen ED clinical nurse specialists. Another advanced practice RN is what's called a CRNA, which is a nurse anesthetist. They monitor hemodynamics and vent status of patients in the OR. They can also perform nerve blocks. They place A lines, which is arterial lines, epidurals, etc. The last APRN or advanced practice RN is a nursing midwife. They do physical exam, they prescribe medication, they do gyne- gynecological care, infertility, menopause, etc. They all operate under that title, APRN. In some states, they are even autonomous, meaning they can have their own practice. They don't have to have a supervising physician agreement like a PA. Another side of nursing that I found when I came over was the grad side of nursing, which is the graduate nursing. You have the master's level of nursing, which you have what's called a nurse informaticist. They're kind of merged IT and nursing together. You have you could just get your master's, your MSN in admin or education. You can get your doctorate, which is your DNP. You can get your practice DNP being an APRN, or if you're not an APRN, you can do it in executive leadership. We even have a PhD nurse scientist. I think the most fascinating thing about me that I've noticed is when I'm looking at all these tracks, especially from being a paramedic, it seems like my experience can fit in any one of these areas. But in any one of these areas, income wise, it's going to pay off. As a staff nurse, I'm just going to be transparent with you guys. As a staff nurse, after your first year of nursing, you should be making in your mid 80s or not, if not 90s, as far as your range, your annual range. On the grad side of nursing, it's usually about 110 and up. And I know CRNAs that are making 200K and up. So the money is here and the growth is here. We just need to add you to the team for expansion. See you guys after the NCLEX. Take care.